Manila Central University College of Optometry taking Ocular Disease2 under Doc Alejandro Caina, number 6, Basquiñas Abigail D, OP31. 8. Ocular Examination. Number 1. Visual Acuity. For visual acuity, I will use Snellen chart for distance, and for her visual acuity at near, I use Geiger chart. Number 2, external eye examination. For her eyelashes, to check her eyelashes, I instruct the patient to close her eyes for a while. Eyelids, I instruct the patient to look at my nose, and I inspected it using a pen light and a magnifier. Her palpebral conjunctiva, I did the eversion technique for her upper eyelid, and I did the lid traction for the lower eyelid. Number 3, pupil. Odin OS 3mm. Pupils equally round and reactive to light and accommodation. In pupil, I did the direct and consensual reflex as well as the swinging flashlight test to check her pupillary light response. Extraocular motility. For the extraocular motility, I instruct the patient to look at the tip of the pen without moving her head, then perform right to center, left to center, upper right to center, upper left to center, lower right to center, lower left to center. Number 5, visual field. For visual field, I did the confrontation test. Patient cover her left eye with the palm, and I instruct the patient to look at my nose bridge. Then patient should report if there is a movement of the finger. Number 6, biomicroscopy. For biomicroscopy, I only use pen light and magnifier. Number 7, tonometry. I only did tactile tonometry. As you can see, I'm pressing her eyeball, nose tip, and forehead from time to time to compare the hardness of her eyeball to her nose tip and forehead. Number 8, ophthalmoscopy. In ophthalmoscopy, I did the direct ophthalmoscopy to check the status of her fundus as well as her red-orange reflex and fovea reflex. This is my third patient's record. Name Erna de los Santos Basquinas, age 43 years old, gender female, date of examination March 16, 2022, address Block 6, Lot 15, Phase 4A, Victoria Hills, Eastwood, Greenview, Barangay San Rafael, Rodriguez, Rizal. Contact number 0928-704-1182. Vaccination status, fully vaccinated, Sinovac. Chief complaint, blurring of vision and headache. History, patient is experiencing blurring of vision at far. Medical histo, high blood pressure. Medications, losartan 50 mg. Optohisto, no eyeglasses. Ocular examination. Number 1, visual acuity. For BADSC, ODNOS 6/9 or 20/30. BADPH, ODNOS 6/6 or 20/20. BANSC, ODNOS J1. Number 2, external eye examination. Drawing 1, eyelashes. ODNOS, no flakes. Eyelashes are pointing away from the eye. No foreign body, no redness, no mass. Drawing 2, eyelids. ODNOS, no mass. The eyelids are 2 mm below the upper labial margin. Eyelids open and close properly. No eye discharge, no redness, no lumps. Drawing 3, palpebral conjunctiva. Reversion technique is performed. Upper palpebral conjunctiva are tested. No foreign bodies, no redness, pinkish in color. Number 3, pupil. ODNOS 3 mm. Pupils equally round and reactive to light and accommodation. Number 4, extraocular motility. The 4 recti muscles and 2 oblique muscles are intact. Innervations are working properly. ODNOS no nystagmus. Number 5, visual field. All 4 quadrants are visible and equal. No scotoma, no restrictions. The patient should be able to see the 4 quadrants in both OD and OS. Number 6, slit lamp or biomicroscopy. First, eyebrow, ODNOS black. Second, eyelashes, ODNOS no flakes. Third, eyelids, ODNOS no mass. Fourth, cornea, ODNOS clear. Fifth, conjunctiva, OD no redness, OS has pterygium nasally. Sixth, sclera, ODNOS egg white. Seventh, iris, ODNOS brown. Eighth, pupil, ODNOS round. Ninth, lens, ODNOS clear. Number 7, tonometry. I did tactile tonometry. Time check 9 p.m. ODNOS firm. Number 8, ophthalmoscopy. First, red-orange reflex. ODNOS positive. Second, media. ODNOS clear. Third, optic disc. ODNOS well delineated. Fourth, CD ratio. ODNOS 0.3. Fifth, AB ratios. ODNOS 2:3. Sixth, cotton wool spot. ODNOS negative. 7th, edema, ODNOS negative. 8th, exudates, ODNOS negative. 9th, hemorrhage, ODNOS negative. 10th, fovea reflex, ODNOS positive. Impression, error of refraction, OU, pterygium OS. Plan for refraction, refer to ophthalmologist for pterygium removal. Name number 6, Basquinas Abigail